sleep? Is it worth your while as innovators or investors, or is it just a fad? I'm excited to welcome K. Koti Patel, CEO and Chief Visionary Officer at Indus River, to the stage to share some very interesting insights with you.
Just because you're awake doesn't mean you slept well. I can guarantee you that. I hope I don't put you to sleep. I'm honored to be here. My name is K. Koti Patel. I'm with Indus River Ventures. And before I get started and follow up some amazing speakers you all have had today, I had to give a shout out to some very important people that have allowed me to be here. My amazing wife, Kusum, who's back here in Houston, and a little 4-year-old Krishna, who is inspiring to be a doctor. And we all know the world needs more Indian doctors. So with that being said, my mom and the rest of my amazing family that are physicians, or some of them are, that have allowed me to be here, but more importantly, this amazing team that I work with at Indus River Ventures, and I'll kind of explain what Sleep Life is. And with that all being said, I'm here to talk to you about something I'm really passionate about, sleep. I've had the opportunity of being in sleep and being in healthcare for 22 years. And it's allowed me to have some unique opportunities that often a lot of us don't get. I'm actually not really smart. I didn't pass organic, and so therefore I can follow in the family footsteps of being a clinician. But what I did get to do is become an entrepreneur. And being an entrepreneur, I was able to kind of learn a little bit about some of these challenges that occur in sleep and kind of work my way into figuring out what solutions I wanted to create. And out of all that, we realized that there needed to be investments made in sleep, and there needed to be changes made. And so we started a company after a series of 22 years and lots of sleepless nights, a incubator accelerator that was focused on investing, commercializing, and providing support around people that had great ideas. Because we know that there's a ton of tech and there's a ton of ideas, but people are really important. And so with that being said, we started getting conversations and questions about, hey, Koti, or hey, Indus, where do you think sleep is going? And so it started this narrative that we hope to guide everyone through, and the answers that we wanted to give everyone. The reason I'm here is sleep really a fad? Is it a failure? Dare I say that? Or is it the future? And so with that being said, I hope I can answer some of your questions. But some of y'all might know Des, right? Everyone knows Des? Des? No? Okay. Des is dysfunctional every night sleep. Des is kind of that coworker of yours that probably didn't get a good night's sleep, and Shelly did a great job explaining that if everyone slept better, they'd be kind of kinder and gentler, and I'd have to agree with her. But Des was actually a neighbor of ours who lived on a floor in a high-rise that lived in Houston. And Des, to kind of give you a description and not take up too much of your time, he at times looked like, and imagine this, Charlie Sheen, kind of appropriate for Vegas, Charlie Sheen from Wall Street, right? Really put together, he's got it going on. And then like the next day, he looked like Charlie Sheen from 2.5 Men, but right when he was gonna get kicked off. Big difference, right? And that had a lot to do with sleep. So with that being said, as a neighbor, I ended up going to a dinner party with him. And I can't say the dinner party was the most exciting dinner party in the world. And the funny thing is we hadn't served wine yet. And I'm looking at Des, and Des is kind of like passed out or getting ready to get passed out. But that was kind of like the narrative that I'd seen in Des a lot. And so, I wanted to kind of ask him a couple questions. And with that being said, I hope that you'll share with me. So by raising your hands, will you let me know if any of this is you agree to? So how many of y'all have occasional sleep issues? Well, God bless you. I've been in your bedroom now, okay? How many of y'all occasionally, or how many of y'all actually wake up every day as excited and as crunk as I do at 3:30 a.m.? Okay, y'all are paying attention. I love that. Okay, we should talk. We're hiring. So with that being said, sleep, and then, one other question is, how many of y'all listen to your mom who occasionally says, you're not feeling well, Cody. Why don't you take some melatonin? We all occasionally do that. That's cool. Thank you for engaging. This is, it's kind of foretelling about what we're going to talk about in terms of engagement. So sleep is an issue, and even though 1/3 of the room didn't admit to it, the CDC says that, at least 1/3 of us have sleep issue, and you've seen numbers throughout the days that show that it's a lot more than that. And having the opportunity to work in the post-acute sector, I've realized that, sleep in conditions such as COPD and CHF and, diabetes and data that we already know, is exacerbated by getting bad sleep. And so, it's often awkward for y'all to have this conversation and tell me you've had bad sleep, but we all know it. That's why we're here, right? So we're going to get to the point of, is sleep tech, fad failure future? And so the CDC says that it's an epidemic. I've thought it's been an epidemic forever. So sleep is a healthcare epidemic. And that's what really got me to be passionate about sleep. Because I didn't want to do the things that were fun and that were easy to work with. I just had to, I guess, do something that was challenging. And sleep ended up being the challenge that I wanted to kind of take up in my life. So, thanks to the likes of people like Arianna Huffington, and I know many of y'all that have worked really hard to be in healthcare and really done a lot of patient engagement, and then you get Arianna Huffington, who elevates the bar in sleep, but thank Arianna for that. And then you've got individuals such as Dr. Oz and other leaders that have really brought the narrative of sleep up. So I wake up January 1st, got a good night's sleep, but of course I didn't go out the night before, pretty smart amateur night. And I'm watching all the major media outlets. And the conversation on health is all about sleep and bad sleep. So then we all know that sleep is truly not, it's clearly not a fad. Can we go back one? Nope. Sorry. Okay. So it's clearly not a fad, and I hope I've convinced some of y'all that it's not a fad. It's become elevated. Thank you. And so then we've realized that as part of this trend, being at CES, it's kind of unique. You buy a device, you get better sleep, right? I mean, everyone's got a wearable. You buy a device that says, if you use it this way, you'll sleep better. But when you start looking at the stats that, the CDC and all this data that comes out, there's a proliferation of information. And, people have these table-side devices. They have, the use of telemedicine. And, sometimes people use their CPAP. Sometimes they don't. And there's this analysis of paralysis. And there's all this data that's coming out. And every day, and it seems like almost every multiple times a day. Last night we were at a speaker's dinner and somebody said there's, in the ecosystem of apps, about 300,000 health apps. That's ridiculous. And a majority of them, not ridiculous in the sense that there's so many apps, it's great, innovation is amazing, but which one do you choose? Which one do you engage with? And so with all of these amazing things out there, there's all this data being collected on a regular basis. And so what is happening with that data? And so in 2014, the CDC said 65% of Americans weren't getting adequate sleep. They weren't getting 35%. They weren't getting the 7 hours of sleep that they need. So then what do we do as and I'm speaking just in the US, what do we do as consumers in the US? We go out and buy wearables, right? And we bought, spent a fortune on wearables. And I'm talking about the wearables that impact sleepwear. And you would assume that you would get better sleep. But last year, thanks to Jill, had some speakers that actually spoke about that in the CDC's most recent findings is that the epidemic increased and 14% additional of the population didn't get good sleep. And so with that being said, this collection of devices and data is not becoming actionable, because if it was actionable, then people would get better sleep. And so that kind of brings me to a point that, maybe sleep is, and dare I say, a partial failure. I mean, it's kind of risky to say that at a sleep tech conference, but I think it's a partial failure. And the problem solvers that we are at Indus, River Ventures, the company that I founded, being from Houston, Texas, the epicenter of healthcare, as I believe it, the largest medical center in the world, we kept on hearing this, Houston, we have a problem. Hopefully I woke some people up in that. And so we realized that we needed to not sit on the sidelines. We wanted to make an impact. And having all this experience, what were we going to do different than all these tech geniuses, from the likes of Restman and Philips that had come before us, and amazing companies like Google and Apple and Fitbit and companies that had wearables. Well, our approach had to be different. And by all means, we weren't going to reinvent the wheel. I mean, somebody had already invented it. And so maybe it was that nothing works in isolation. And so with that being said, we realized that, we at RRV needed to come up with a solution, and we were passionate about that solution. And so we came up with Sleep Life. And while many of y'all, I hope, will Google Sleep Life and look us up on Twitter and follow us, there's really nothing out there yet, because I really wanted to call it Nightlife. I thought it'd be really cool, but then my colleagues reminded me that we weren't going to start a club in Ibiza. We weren't finding a club in Las Vegas. And I was like, but it sounds so cool. We wanted Sleep Life to be really passionate, so we came up with the name Sleep Life. And one of the key advantages I had was that I'd worked, thanks to my mother, who had been a respiratory therapist, I had a chance to work in healthcare delivery. And so I had the ability to go out and deliver a CPAP or a nebulizer to a patient's house. And I had the ability to do this in the Medicaid space, in the Medicare space. I had a chance to, see people in a glitzy part of Houston, and as well as people that had economic challenges. But I was humbled by that experience. And so after working with my mom for a long period of time, I decided to, with her blessing, go spread my wings. And 5 years ago, I started a company called Vitalis. And Vitalis is an amalgam of a sleep diagnostic company, a sleep respiratory provider, and a series of other companies that provide post-acute care. And what we realized is that, I had this ability to have access to patients and being able to service them and serve them passionately, understand this provider experience firsthand and what was broken. And so when we built the Sleep Life concept and the solution, we wanted it to be an ecosystem, not just a platform, because people already had solutions out there. And so we wanted to make sure that Sleep Life improved a couple of challenges that I was aware of, that I hopefully spoke a little bit about at DES. We want to improve identification, because I think a lot of us have, I'll use my Apple iPhone. It tells me that I didn't sleep but 4 hours, 5 hours, but there's not anything actionable. And so we wanted to identify what that issue was, or at least get people to identify it. And then once we got somebody to identify it, the next problem we had was engagement. And I will tell you that by the amount of people that didn't raise their hands, engagement's always a challenge, right? It's kind of awkward when we're in Vegas and you don't know me and tell me what you're doing, but engagement is just a general challenge anywhere. And so we wanted to make sure that engagement also involved a provider, and at times we also had the payer involved. And these are probably things that you've heard, and these are challenges that we wanted to resolve, and we'll talk a little about what we are doing to resolve it. And then the last part of it is we wanted to make sure there was activation. Okay, so my iPhone says I only slept 5 hours, and now I'm needing to get better sleep, and so what am I going to do? And then how do I create that activation? And so some of the things that we wanted to do is, at Sleep Life, we wanted to change a narrative on the industry. So I know that our IP attorney doesn't want me saying a lot of this, and neither does some of my board members, but at Sleep Life, I don't know many of y'all that have had the same awkward but pleasant experience at my company is getting a diagnostic sleep test at a sleep center. Does anybody have that experience? Thank you. And so, with that being said, it's really awkward having somebody watch you while you go to sleep and you got all these, electrodes on. So I started asking myself, why do we have to do nocturnal diagnostic sleep tests? Even though it is the gold standard, don't get me wrong, our sleep docs, I'm not disagreeing with you, but the symptoms present themselves during the day. And so why couldn't we get this nighttime score during the day, right? And why not take a subjective questionnaire and have an objective? And so without saying too much, that's kind of one of the things that we've come up with. We've been working with patients, we work with some amazing providers, and I really, really feel that in the next few months, we will actually be able to publish data and information and an algorithm that makes sense and say, hey, you know what? You might not want to get that nocturnal nighttime test, but we'll get a daytime test in a very small, brief sitting, and we'll be able to then create that identification clinically, right? Because we want this to reside in the appropriate hands. And so that is part of the platform. And what we're not here to do is sell devices. and I know I'm running quick on time. So what I wanted to say by that is I truly believe that sleep tech is the future. I believe it's an amazing future. I think that it's grown. I can speak for what we're doing at Indus River Ventures in Houston, as well as what we're doing at Sleep Life. I think that there will be this narrative that it's not just about weight and eating and so on and so forth. I think it's going to start with sleep, because that's at 1/3 of everyone's life that nobody should worry about. And with that being said, I've run out of time, and I hope that I'll be around and I can answer any questions. I hope everyone sleeps well, and I hope everyone has a great day. Thank you so much.
Thank you so much. Appreciate it.